Welcome to Ageless with Adrianne. I'm Adrianne Caparuso. Today I want to talk to you about strokes, stroke recovery. A lot of times when there's a stroke or a mini stroke, sometimes a certain amount of physical therapy is given and then insurance stops paying for that and physical therapy stops. And so many times people think, and sometimes physical therapists say, there's nothing more we can do. This is all the recovery we're going to get. And stroke recovery can occur years after the stroke when the movement and the training continues. So today I wanted to show you 3 different things that might enhance some stroke recovery if someone you love has experienced a stroke, or if you've experienced a stroke and you've kind of given up and you think it's hopeless, that you're never going to have greater recovery. It is possible to have more recovery. So let me show you 3 different exercises. I'm going to start seated. One of them is a very kind of foundational basic exercise, and it depends where the stroke has impacted the body, right? It's always going to be different for every person. But an exercise that you can try is to have 2 bowls, and depending on whether or not the right or the left has been impacted and how severely, you're trying to get movement back into the area that doesn't want to do what the brain wants it to do, if you will. We're trying to get some connection between the brain and the body. So you have 2 bowls, and you're going to put different objects in one of the bowls. It doesn't matter what it is. But the goal is to try to move the objects from one bowl to another bowl. And while this may seem very basic and foundational, it is not. When somebody has had a stroke, it's quite serious, and sometimes the most, what we would consider, those of us who have not had strokes, the most simple of movements can be very complex. And it's not anybody's fault, it just is, and it's how the stroke impacts the brain. And so again, we're trying to get that brain-body connection realigned. So while, like I said, while it might seem like it's a very basic foundational exercise, it is not. It can be quite difficult. So you want to start with just trying to pick up, using the 4 fingers, trying to pick up one object and putting it in the other bowl. And sometimes, depending on what side it is, even if the hand is working, sometimes the arm is not, right? So sometimes you might be able to move these extremities, this extremity, the fingers, but you might not be able to move the arm. So even getting the arm from one bowl to move it to the other bowl can be tricky. So again, you're just going to pick up and try to move from one bowl to the other. And with both sides, because even though one side is obviously most likely have been impacted more than another, sometimes both sides aren't working. And so you want to try it with both sides as well. And just pick up the objects. I just have some random things that my kids had in their room, but just pick them up and move them to the bowl. And see if you're the one who had the stroke, or your loved one is able to do that. And don't give up if they can't, because today they might not, but tomorrow they might. This is where the training becomes quite important, because you need to do these things over and over and over again. And it can get very frustrating for the stroke survivor. But if the quote-unquote therapy is there, if you are helping them, if they want to improve, things like this can get better with time. It's possible. And so then, obviously, once you have everything into the bowl, try to move it back. And again, use both sides, move it back. And so this is an exercise that you can try with a stroke survivor, just to see what they're capable of, if they're having issues moving different parts of their body from the stroke. So that's one thing you can do. Another thing is, and they can be seated or standing for this, depending on where the stroke has impacted. And a lot of what I'm telling you, I'm giving you these exercises, but a lot of this is a case-by-case basis. I can't say to you, oh, keep them seated, because maybe depending on the recovery, depending on what the situation is, we want them standing. And we might want them standing on an unstable surface, which I will get to in another video. But you can try this seated with them, see if they can bounce a ball and catch it. And if not, again, this is just something to practice. So you want to bounce the ball and catch it. And try it with one side, but then also try it with the other side. And again, they might not be able to do this, and that's okay, because this is something that the stroke survivor then works towards, whether it be you or someone you know. The other thing you can do is have them stand up. I don't have shoes on, and it's okay from a proprioceptive perspective. It depends if the stroke has impacted hips, legs, feet, just depends where the stroke has impacted them. But if they can feel the floor, it's going to help their balance. We want to make sure that there's good hip alignment when they're standing, because sometimes there's drooping on one side, right? So we're trying to get them to activate a lot of what's happening in their core and their hips, or you activate what's in your core, your hips, to stabilize so that the recovery, when you have the movement, the recovery is in proper form, right? So again, you can just stand to do it. And I've talked about unstable surfaces. This is as a progression, it's fantastic to do this on an unstable surface, but that's another video for another day. So bouncing the ball, moving things from one dish to another, bouncing the ball. And then the last thing is with a towel. Unfold a towel. It doesn't matter how big it is. I just happen to have this one nearby. So see if they can use their hands to fold the towel. And they might not be able to do it the way you or I do it, like this, but they might be able to do it if it's laying down. So you might want to put it on a table or on their lap, because I'm going to keep it folded in half for now, because just the size of my lap, because it might be difficult for them to even do this, right? And then this side's got to catch up. So these are different things. I want to say things that we take for granted for the people who haven't had strokes. This is stuff that we take for granted, but these are things that if you can work with your loved one, if you can have someone work with you, if you're the stroke survivor, this is a really great way to try to get some different pathways of blood flowing back to the brain and get the brain connected to the body so that the body starts to understand and remember how to do these things. So dish to dish, bowl to bowl, moving things bowl to bowl, like moving the body, bouncing a ball, seeing if they're able to catch it, if you're able to catch it, and then folding the towel, because this is some of your fine motor skills, right? And a lot of times when there's been a stroke, fine motor skills are impacted greatly. So we're trying to pull some of them back. And again, if physical therapy has run out, insurance isn't paying for it anymore, they say there's nothing more they can do, there's generally more that can be done to try to bring some progress. And sometimes it takes a really long time and it can be really frustrating, but it's worth it, right? To bring some of the recovery back. So those are three things that you can try as a stroke survivor, or try with your loved one if your loved one is the stroke survivor.